Eyewitness News is your vaccine authority, and each and every day right here, we're committed to getting your questions answered, and we're still getting a lot of them every day, and we thank you for that. Joining us right now is Lisa Cuchara, professor of Biomedical Sciences at Quinnipiac University. Lisa, thanks for being here with us again.
Thank you, Mark.
I want to get right to the questions because, as I said, we still get a lot of them every day, which I think shows some people still have a lot of questions and a lot of interest in this, especially now with kids involved, which is what our first one involves. Kids ages 12 to 15 are getting the same Pfizer shot that adults get. If shots are further expanded to include children between the ages of 2 and 11, would they be the same shot or a different strength?
So typically we give kids the same vaccine that we give adults. And if you think about a germ or a virus doesn't say, oh, this is a kid, I'll give it a little bit less infection. This is an adult, I'll give it more. But they do look at it. There actually are a few vaccines that we actually give a higher dose to kids. So it's not like medicine where it's based on weight or something like that. This is actually an immune response to an antigen, which is basically something foreign, a piece of a germ in this case. So they will look at that in the clinical trials. They have started these younger children, but it's unlikely that there would be a different dose.
Do you anticipate the younger children, those 2 and older and such, getting the approval for it?
Yes, I would expect by fall we would have that approval. Certainly the approval for the 12 and up came a little bit sooner than we expected, so we hope that that might be the case. But for the next group, they certainly do a little bit more analysis with that age group.
Yeah, that certainly makes sense. Our next question here is from Kathy from New Hartford. She's asking, some young people aren't getting vaccinated due to concerns about infertility and fertility. Will the vaccine affect the ability to have children in the future? Will it cause any birth defects or genetic abnormalities? Does it change a person's DNA?
So to answer the last part first, no, it does not change our DNA. So the Pfizer and Moderna is a one RNA molecule. If you get infected with the virus, you would actually have that RNA molecule plus 28 other ones. If you think about your kitchen being a cell and your refrigerator being your nucleus, your DNA is actually in your nucleus. The RNA never goes into that area there, so there's no possibility that it could affect our DNA. As far as fertility, so there was a misconception that was promoted out there by some of the anti-vaccine people that it actually could affect fertility. The hypothesis was that if you made an antibody to the vaccine, that it would cross-react with the placenta and cause infertility. There was a few things that were wrong with that. So first of all, if you have a placenta, it means you're pregnant. So it can't really affect fertility if you're already pregnant, and that was the hypothesis. The second part of it is if that antibody could cause infertility, infection would be doing the same thing. So we would be seeing that happening quite often. So there's really no scientific plausibility that it could affect fertility. There's really no reason to be able to fear that at all.
All right, well, that's some good news right there. Lisa Cuchara, thank you so much for joining us again this afternoon from Quinnipiac University. We always appreciate it. It's good to see you.
Thank you, Mark.